In today's video, we're going to be talking about, can we have guilt and gratitude in the same place? And I'm very pleased and very happy that my sweet, albeit quite shy, husband is joining me today to have this conversation. So one of the things that we're really grappling with is the gratitude of this opportunity that's coming in 11 months and the guilt of leaving our patients for a whole year and what that has been like, the push and pull of that. And today we want to talk about some of the details of the things that we've struggled with and how we're coming to terms with that. So the first thing that I want to express is that over the last many years, I have felt a lot of frustration with the healthcare system in general. And that's what prompted me to open my own practice. I'd spent some time working for a company that didn't align with my personal values, and that I didn't feel like was providing the type of care that I think is important. So I left that model. I opened my own practice so that I could give patients the one-on-one, very specialized, very intense and concentrated and high-level care that I feel like they deserve. But with that comes also taking on a lot of the burden of being like a primary care provider for these patients, which is often my primary role, is to just get them to the right people.
Yeah, so to slow you down for a second, you've taken the past 10 years to develop the relationships with patients so that they trust you in many cases more than their primary care providers. They might even treat you like their primary care provider. For us to have this space where we might not be available to them for a period of time, that can be scary for them.
And I feel a lot of guilt around it.
Yeah.
And something that prompted a further discussion of this is I was actually reading an article in my own profession's magazine, the APTA magazine, and it was discussing just that, physical therapists as primary care providers, which basically means like a first point of service. When a patient comes in and you're the first person, you have to screen for all the big bad things, which I have done for 25 years.
Yeah, how many times have you seen a patient where they come in and say, I don't even know where to go anymore. I've been to the doctor this many times. They keep telling me I'm fine, go home. And it turns out
it's something serious.
It's something serious. Like you literally saved somebody's life that day multiple times.
Yeah, so there was a really specific case, and obviously I'm never going to mention any details or patient names, but this article I read the next day after a patient came in who clearly had displayed the signs and symptoms of what's called a TIA. Some people like to call it a mini stroke. That's not really an appropriate medical term, but a transient ischemic attack, which basically they became paralyzed on half of their body while they were at the gym. They then went to another medical provider who was not a physical therapist, and they proceeded to not examine them, not send them to the emergency room, and perform arguably a pretty dangerous treatment. It literally could have killed them. They end up in my office the next day, and I remember thinking, why am I the one catching this? It was really, really frustrating, and this is something that happens all the time.
You probably have dozens of these examples.
Yeah. Oh God, more than dozens. I probably have dozens a year. So with that, it comes great responsibility.
And that's the Spider-Man quote, right?
What is the whole quote? Great power.
With great power comes great responsibility.
Yeah, I guess so. So the next day I read this article, and it's debating whether or not physical therapists should be in this role. And physical therapists in the military are physician extenders. They're in this role. In a lot of countries around the world, they function in this capacity. And we have a lot of direct access now, and our education is definitely differential diagnosis. And we also spend so much time. Even providers that are in like what I call the puppy mills, they're still spending more time than most primary care physicians or most specialists.
Even though they're hamstrung. Like you can't order blood work.
Correct.
You can't order an MRI or an X-ray.
Right. There's certain states in the country where I can, but in general I cannot. So I have to develop relationships with other providers that trust me and trust my diagnostic abilities to help me carry through those things, which is very, very frustrating. So I have to do a lot of fighting for my patients. I read this article and I'm thinking, for real? Is this a conversation we're having now? I feel like I've been doing this since I graduated in 2002. And this is like a conversation we're having in 2025?
Right. So, which prompted her, again, she showed me, so I was privy to it, prompted her to send a text to some peers just to see, am I the only one feeling this, or do you guys feel the same way? And the peers that we're talking about are colleagues that helped develop you, right? And then also colleagues that are now practicing professionals and have been for many years, but that you helped develop them. So It's almost, if you will, almost like intergenerational levels of physical therapists here,
For sure.
right?
For sure.
And
each with like their own area of specialization. You know, some are neurological specialists, some are orthopedic specialists, you know, but they're all physical therapists foundationally.
yeah,
And these, to be fair, are just a handful of the very, very best physical therapists that I know. These are exceptional people. And I would love to mention their names, but I don't know if they would appreciate it based on some of the stuff I'm going to share. But
yeah, we won't.
Yeah, we won't do that. But know that if you're watching, I love all of you.
And she shared the text with me because ultimately it provided a lot of confirmation on what we're doing is right, what Tiffany is doing is right, taking a break. Just, it's exhausting.
It's rewarding, but exhausting.
Yeah.
Physically and mentally.
Yeah. So some of that confirmation I'd like to read from that text message, this quote that says, I honestly act if the primary care physician knows nothing and did nothing. The amount of times I ask for blood work because they did none or imaging because they did none is literally all the time. I catch stuff all the time, and patients are asking, why did no one else ask that? And all I can say is, I'm not sure. And in my head, I'm thinking, it's because they don't know or they don't care. And then all the other people on that message just responded like, exactly, you know, what she said. Tiffany had a response that's wondering, is it because you guys have practiced so long and have you just seen all the things and you're just jaded about it or pessimistic? Or is it that doctors have become or are becoming or are training to be lazy and incompetent? Is it the system? Is it the person?
And to be clear, we're speaking about the medical field because that's the field we work in. But I'm not sure that this doesn't translate across all professions. I feel like there's just such a small percentage of people that are really invested and really trying to develop themselves professionally, clinically, and they really care about their patients. And often I've also seen other providers that they did, but they're so burnt out by the system and the process that I see that waning.
It's funny.
Time.
So providers are burnt out. Patients are often burnt out. That's how we get them a lot of times, right?
They're frustrated.
And you're talking about relationships. So we have relationships with our patients. We have relationships with other physicians because we have to, or other providers because you have to go to them to get the imaging or the blood work that you want done or whatever is necessary. But then you also have these relationships with colleagues that have also, you know, gone above and beyond or are continuing to go above and beyond and teaching others to go above and beyond.
Well, there's a quote in there from one of my friends where we will often go to this network of people before we go to even a specialist. So as we were discussing that in the string, one of my colleagues, this is what she said about her.
Right. So just as Tiffany sent this text message to these colleagues, one of the respondents also said that she comes to the people in this group, quote, before she trusts her child's highly specialized pediatric endocrinologist. She had to bring in a medical journal article before he took me seriously, and he was not up to date on the most current treatments. You really do have to be your own advocate.
And the thing that's hard about that is this is someone who's medically trained and highly intelligent and very versed in the medical system. Imagine what that feels like as a patient who is not versed in that. And so we end up becoming the liaison between those environments to help advocate for them. And then back to what we were talking about, that's the terror I am having from some of my patients that service will not be there for a year. Makes me feel really terrible.
Right. We continue to talk about relationships and relationships with patients, colleagues, other providers. And one of the other respondents said it so easily that if you just listen to the patient, they tell you what they need. She said, so I'm going to quote, she said, I feel like people are just incompetent most of the time and lazy. This is another physical therapist
Different
speaking.
one.
I also think with the way healthcare is going, people are seeing too many patients and not giving people enough time and not listening. If you just listen to the patient, they'll tell you what they need, end quote.
And in our particular practice, we have created an environment where we have an hour to listen to a patient every time we see them, which is an extreme privilege in the world of healthcare. Because the system, the model has changed. And I believe I read something the other day that said the average provider has 5 to 7 minutes with a patient, which is not only impossible for a provider to make an appropriate diagnosis and treatment plan and educate, impossible, but I would argue downright dangerous.
Yeah, and how many times have you been to the doctor and you even got 5 to 7 minutes? And of those 5 to 7 minutes, were they sitting down and reading their chart? They weren't prepared for you. They were looking at it as they walked in the door.
We have a network of providers that is not like this, but that has taken almost 24 years to build that network of trust.
Correct.
So for the patients who are watching this, and I've told a number of you, those are the people that are going to be on our website when we leave with their pictures, their bios, and their contact information. These are the people that we would go to, that we recommend. Now, that doesn't mean there's not other great providers out there. Of course there are. There's a lot of really terrible ones. There's a lot of really mediocre ones. And these are the wonderful ones that we know. Of course, we're always trying to meet like-minded other people, but it has been difficult, and certainly in certain branches of medicine, to find colleagues that I really think are invested in patient care and are highly intelligent and competent. I won't mention those branches, but
we have a blacklist.
I think my peers, we know what branches we're talking about here.
There's one more quote. It's a little bit long, but you felt when we were looking at this that it was worth including. So
this is, these are smart people.
This is physical. She's a neurotherapist, right? She's a neurospecialist.
Yeah.
So she said, it's healthcare and insurance. And
you sounded very Boston right then.
Boston. It's healthcare. It's healthcare and insurance and conscious capitalism and on and on. Our country needs a major overhaul of some sort. All you guys on this little text thread are the gold standard of care and the best folks I know and have been privileged to work with over the years. I got an MBA this past year to see if in my next life I can work directly in some sort of healthcare reform and affect change at a larger level. But if I'm honest, I can take a job in another industry for more money and work remotely. There's something wrong with that entire picture related to healthcare costs and workers in general. I haven't sold my soul yet, but as a clinician, I'm appalled, and as a parent of a kid with chronic issues, I'm appalled at healthcare in general. Not all clinicians are you guys.
Stuff like that gets me choked up because it's weird.
So you have the gratitude,
right,
not only of the ability to take some time off, but also of having a network of peers, colleagues, other providers, and the patients that so often show you their gratitude.
Oh yeah,
right.
Yeah.
And of course, we've already shown. Hopefully, you get by now why there's guilt there too, because there's that space. But we're going to try to fill that space as best we can.
As best we can. Yeah. And then there is going to come a time where we legitimately need to retire. Either my body won't be able to take it anymore, or we'll decide we're at a different phase of life. Whatever, that transition will be even harder.
Sure.
So with that said, this conversation, I sort of vented to my peers, and I was really frustrated. And then it turns into this. So I have all this guilt and shame and sadness and frustration. And then throughout the course of this dialogue, now I'm super grateful and I'm feeling really supported. And I mentioned to them, I'll let you quote what I said, but I was expressing to them my guilt.
So in the message, Tiffany had said, I have all this guilt because I know my patients are so upset that I'm leaving, but I just need a break from all of this. And the first response back was, I also feel so burnt out because we can't be the only ones that care. It's exhausting having to be the only advocates for our patients.
And I'm sure that that's not always true. It's just it seems so prevalent. And I'm curious, do other healthcare, I'm sure all branches of healthcare, people who are invested, they all feel this way.
Love to hear.
Yeah, share it down below. Use this as a place to vent some of your frustrations as a patient or as a provider. There's a broken system, and some of us are trying to do the system a little differently, but in order to do that, we've had to step outside of a traditional model, and that's not available to everyone.
Yeah, and to give you an idea of the kind of providers that we're going to be placing our patients' care in, they immediately said, go and enjoy, you've earned it. We'll step up and fill that gap.
Oh yeah, are you going to read the one in particular?
Well, she said, do not feel guilty for 1 second, you earned that time. Someone will step up. Try to send them to one of us. She didn't even say her, because she's not trying to steal the business. She just said send them to one of us, because everybody on this thread knows how good each of the other is. Mm-hmm. And she said all the younger people in this group were taught by the OGs. That's why we think and treat the way you guys do. We will pick up where you left off. I got a few more years before I figure out that I'm going to have to do something different. Probably a decade, because it's going to take me that long to figure it out. But go enjoy what you've earned.
It was very sweet.
Very sweet. Yeah. And then the one that's a neuro,
There's a couple of neuro specialists on here.
Oh, right. Yeah. With this one, she said, no guilt. Can't take care of them if you don't take care of yourself. You're one of the best clinicians and people I've ever known. You've made enormous impact for so many patients and clinicians. You deserve anything you want and need.
Oh, so sweet.
Yeah.
Don't make me cry again. Stop it. I don't think you can read the next one. Ooh. I'm going to look terrible in this video.
Well, let's see if we can get through one more. This person said...
Now I'm starting to feel like we're just like inflating my ego.
Maybe a little bit.
But maybe it helps me to feel better about what we're doing.
Well, it's good to get confirmation.
Sure.
So this person said, absolutely, all caps. You will never know the amazing ripple effect you've made, and continue to make. Know that your year of rest and refreshment and break from patient care will still impact people you meet in those special ways. You will always be a catalyst for greatness.
Hopefully this will be an example of that.
Yeah.
We can, it's kind of weird to think of trying to help people not through healthcare, but I do think for me personally, and I'll let you speak for yourself, I don't think that I could retire and not feel like I was helping people. So I'm hoping that this becomes a tool for that. That it's a different subject matter. It's like, hey, if you want to take a break, like, how can you do that? Or if you want to go on an adventure with us, come along for the ride. You know, I've had people tell me, you know, they can't travel, but they like watching it, and so on and so forth. So I'm hoping that that need to provide help is a little bit filled by this experience over the year we're gone. I guess we won't know until we try.
So that text exchange that we just shared pieces of with you started off as a vent and ended up as a major confirmation where you felt confirmed and justified and refreshed maybe a little bit and ready to continue through this next year to line everything up so that we can take that year off, still continue to help people in different ways, but refresh ourselves.
It also gave me a little boost for the next 11 months ahead. Do what I do well, pour that last little bit of energy into making sure that people are getting what they need, and helping my patients to continue to realize that I'm just a tool in a toolbox, that they're not dependent on me, that I'm just someone that's helping them along their path to wellness, and that there are other people, arguably other people that are much, much better than me, that can help them.
Yeah. So can guilt and gratitude exist in the same space?
For sure.
Yeah, I think so.
I feel tremendous gratitude to you for being the kind of partner that aligns so that we could save our pennies and make this happen, and that you are an adventurous person and you want to do this with me. I think that a lot of people just would be like, you're insane. We're not doing that. And
I'm not going hiking.
You'll go hiking, just not
for a day.
Backpacking.
Right.
You will not see him on backpacking videos. He hates it. But I'm grateful for that. I'm grateful for like my children, and that they're doing well, and that they're, you know, transitioning into adulthood successfully, because if that wasn't the case, we wouldn't be able to leave either. I'm grateful that I have had a professional life that's been fulfilling, and that I have, although nobody's going to ever say any physical therapists make a lot of money, I have made enough, and we have been frugal enough to save a lot.
Yeah, well, and I'm fortunate in so many ways too. You know, you make me better. You've given me this opportunity to help people through your business, being the trainer side of this business. And, you know, I experience that a lot of times with my patients as well, where, you know, they've had another trainer, or they're doing CrossFit, or they're doing whatever, and they end up with me, and I'm showing them something and say, I used to do this all the time, but not like this.
Yeah.
This is how I got hurt. Why did they not show me this? Why did they not teach it to me like this? You know, and I've experienced that too, where patients don't want us to leave, or are counting down the days. You know, they're scared. They're scared for whatever reason.
Yeah, you're not giving yourself enough credit. You know, you consistently undermine what you do. And yes, you're a personal trainer, but you're not. You're so much more than that. The things that you do with patients is so far above and beyond what is typical in that world. And I'm sure if any of your patients are watching this, they're going to confirm that. You have a patient right now who he had a stroke, and he's doing so amazing with you. Normally that would all be done in a physical therapy practice, and then they discharge him before he was really functioning well, and you've taken him to that next level. And so don't don't discount the importance of what you have done as a medical provider.
Right.
Yeah.
Thank you. You know, and I'm also fortunate that I do have another source of income. And so even while we're traveling, we can continue to make some money. We can continue to do these videos and continue to help people. There's so many things to be grateful for. So yes, guilt and gratitude can exist, if not at the same time, very next to each other, like with moment to moment.
Moment to moment.
Yeah.
Yeah.
Yeah, for sure.
And so I'm really grateful to anybody who watches this video, and I feel a lot of gratitude that if you find this helpful, that we were able to do that too.
Yeah, and look for the changes that'll be coming over the year, because we'll be, like I said before, lining things up to put all our patients in the best hands possible.
Thanks.